Today we're tackling the issue of climate change, what it is, why it matters to health, and how sustainable healthcare can help us turn the tide and make us healthier all at the same time. To do this, we're not alone. Bod and I are slightly out of our depth on this one, so we brought in an expert, Dr. Hayley Pinto, who's going to tell us just how intertwined healthcare, and climate change are. So thanks for joining us, and could you tell us a little bit about yourself?
Yeah, thank you for inviting me. My name's Hayley Pinto. I'm a medical doctor, but I was a psychiatrist by background. I worked in addiction psychiatry and ran the services across Norfolk for many years. And then in 2014, a friend showed me some stuff about climate change, and I thought I knew about it, and I realised I had no idea. And I ended up crying in her kitchen, and because I've got 3 kids. And so then started getting involved we set up a local organisation because we naively thought that if we just told people, then everybody would feel as passionately about it as us. But we ended up just talking to people who already knew about it, because you can't get people who don't want to know about it to come to an evening talk. So we do lots of street outreach and school stuff and what have you. And then I got frustrated and started doing some stuff with Greenpeace. And then Extinction Rebellion came along and I got involved in activism. And then kind of got a little bit burnt out doing too much climate activism as well as trying to run the drug service. And so, during the pandemic, I had a little bit of breathing space from the activism to think about where I wanted to put my energy. And I feel like I can do more good for more people by trying to address climate change and continuing to practice clinically. So then I started working for the Centre for Sustainable Healthcare as their education training lead. And that's now what I do, trying to teach people how to do healthcare in a way that's not damaging people and damaging our future.
We want to talk about climate change and that relationship with health, and obviously solutions to what we can do to make health and healthcare more climate friendly. There's other sides to it as well. It's not a straightforward, just do these things and everything will be fine again. There isn't a solution for climate change for that at all. But when it comes to health, it gets much more complicated, doesn't it? Because so much of what we do is related to those unheard or just glimpsed things that we get with a patient, seeing if there's a reaction to something you've said.
I would wager that the vast majority of my patients have never thought about climate change as contributing to their reason that they're seeing me. And it may not, but also they haven't really thought about what the implications are for the future. I mean, a lot of people use the phrase climate change emergency to try and stress how urgent a problem this is. So if we were to look at UK health services in 25 years' time, what do you think that would look like based on what you know about climate change?
So in terms of the illnesses that we're seeing, that will have changed a bit. So first of all, heat obviously is going to have a big impact. We were already seeing that. I mean, the 2022 heat wave caused over 3,000 deaths in the UK and over 60,000 across Europe. So we're going to see more of heat-related problems. But perhaps if I kind of, as I talk through that, also talk about how that's going to impact delivery of service, because at the moment, something like 90% of our clinical wards in the NHS are at risk of overheating. And we know that during that heat wave, we had to turn off some IT systems. We had problems storing medicines at the safe temperatures.
Oh, yeah.
And when it overheats on a ward, there's a direct risk to health for both the staff and the patients, but also it affects staff's cognitive ability and their energy levels. And that's not ideal when people are making life and death decisions. So we're going to have to think about the resilience of our healthcare infrastructure. And that also is true for flooding. So about 10% of hospitals are at risk of flooding. We've had over 200 cases of healthcare facilities flooding already in the UK. So that's going to be a bigger issue. And what we know from studies even in the UK is that people who are flooded in their homes, even 2 or 3 years later, have about 4 times the rate of depression and anxiety and PTSD. So it has long-term health implications.
Yeah.
Those are probably the sort of the biggest direct risks in terms of, thinking about sort of storms and floods and obviously wildfires as well. We're already starting to see an increase in wildfires in the UK. That 2022 heat wave saw over 100 wildfires across Norfolk, where I live. And in many areas, the fire services were only able to respond where there was immediate risk to life because there were so many fires going on. And some of those were impacting people's homes.
In some parts of the States, and I think it maybe even be Canada, they use meteorologists to predict what's going to happen with the temperatures, because we know that there's an increase of 1% of emergency admissions for every 0.6 degrees or something below what temperature is expected for that time of year. So you would kind of hope that people get a bit better about that. The only challenge with that is that we know every Christmas that Christmas is going to be an awful time, and the 30th of December is going to be the busiest day in the NHS. And every year it all collapses every time, because no matter how much we know this, we don't prepare well enough.
So then how do we prepare for something that we know is coming, we don't know the scope of in some ways?
Well, we're not preparing at the moment. I mean, if you look at what's happening in terms of adaptation, not just in the NHS, but if we focus on the NHS to start with, we haven't got the money, the trusts haven't got the money to make the necessary adaptations for heat and for protection from flooding. But we've also got to think about supply chain. So the way that we practice medicine is hugely dependent on complex global supply chains. So you've got to think about extreme weather events in other parts of the world as well, and where are we getting this stuff from? And is it one place that makes one particular thing, and that's the only place that does it? So we've got to think about resilience in our supply chains and potentially moving more of the manufacturing to support the way that we practice healthcare more locally. And certainly Europe is starting to look at that. And we need to be looking at that in the UK as well.
Yeah, again, that was the pandemic lesson, wasn't it? If you order everything from China, and in particular 5 factories in China, and the whole world is ordering from the same place. And we've got used to just-in-time supply works well in some businesses, but it's been shown now that in
the NHS is not a supermarket.
Yeah. For critical supplies, that's a real problem. If you're going to start looking at that, then you need more storage, and you need to think about where that storage is. It's no good if it's in the basement if your hospital's at risk of flooding.
Right.
Yeah. So and equally, if there's no air conditioning in the units. Yeah. I mean, so I was working on a ward for field work, and it would have been a 2018 heat wave. It wasn't as bad as the 2022 one, but I can distinctly remember and wrote in my notes, actually, my observation notes, of one nurse who was pulled off duty to just go around and bin all the medication on the ward because it was about 32 degrees in the ward.
No.
And so everything was no longer viable. And then I asked her what she was doing, and she explained it. And then she said, well, if this carries on, I'm going to have to do it tomorrow. Like, what's the point of replacing this? Because tomorrow, if it's 32 degrees in here, then it's over 25 degrees again. So all the medication is invalid.
And when you look at the fact that 20% of the NHS carbon footprint is medicines and medical equipment, and if we can't store it safely, then that's going in the bin. Medicines wastage is a huge issue anyway, not just in terms of emissions, but also financial costs, but also in terms of pharmaceutical pollution. So we're here talking about climate change today, but of course there's much wider environmental impacts that are becoming more and more problematic as well.
I was talking to my husband about this before, what we were going to talk about and everything. And I was saying to him that healthcare itself is actually quite a significant contributor to the carbon footprint and emissions that we have. And I was reading about how if we were a country, we'd be like the 6th largest emitter or something like that of healthcare. Is it fifth then? And he turned to me and he said, it's like that Mitchell and Webb sketch where they look at each other and say, are we the baddies? And, there's something to that,
difficult,
right?
It doesn't sit comfortably with the first do no harm. We're also a massive contributor to plastic pollution, to pharmaceutical pollution.
Well, single-use plastics. Yeah. NHS is the king of single-use plastics.
We're probably going to go back to the good old-fashioned era of sterilizing everything.
Yeah.
Reusable.
Well, that's one of the things that's happening.
Yeah.
Before we move on to that, I just want to say what we didn't mention in terms of health impacts and what we're going to see differently. Another thing is infectious diseases. So we're seeing, as the earth gets warmer, vectors that carry disease, things like mosquitoes and ticks, they have a bigger geographical range that they can spread to. So we've seen things like dengue fever spread up into southern Europe. We're starting to see those mosquitoes in the southern parts of the UK. So potentially 25 years' time, we could have dengue, we could have malaria. We've already had our first cases of tick-borne encephalitis, and also cholera, waterborne diseases. More problems with toxic algae in our water sources, and that's partly due to heat, partly due to pollution, like the sewage pollution that we're seeing at the moment. But also increasing climate change, that's one of the 7 factors that increases the risk of new pandemics.
Yeah.
And many of the others are about ecological degradation as well. So we're likely to see more pandemics within the next 25 years. And, as awful as COVID was, it did at least have a relatively low mortality rate. But the next one could be worse. And we're not really prepared for it.
But I think as humans, we tend to, though, don't we? We just trot along our lives doing what we do. And when something impacts on us, we then tend to notice it more. Yeah. And we then will potentially do something about it. So, talking to my kids' generation, I'm fascinated because we, as middle-aged, Alexis less so.
Don't look at me.
We have had lots of benefits from living in a high plastic world with lots of mobility around the planet. But the people who are going to pay the cost for that, climate-wise, are our kids, and probably more importantly, their kids. But then talking to my kids' generation about what I think about climate change, they're all aware of it, they all believe it, so there aren't many deniers. But what they feel is disempowered to do anything about it. And they feel that, getting things like a mortgage and being able to feed themselves is a bigger priority to them because the cost of living has gone up so much. So we're in a bit of a difficult fix at the moment because living in itself is not an easy thing. And that's just in a well-off country like the UK, let alone anywhere else in the world.
Yeah. Psychologically, yes, we're designed to kind of look at an immediate threat that we can see and run away from. So because climate change tends to be more slow moving, I mean, I could talk for a whole podcast about the psychological kind of basis of why we're not paying enough attention to this. But yeah, it doesn't tick the right boxes in our brain for a kind of emergency response. And you're right, for young people at the moment with the cost of living crisis and most people in this country compared to when we were that age, struggling to find accommodation that they can afford and, lots of other problems. But a big study looking at 10,000 young people across 10 countries across the world, including the UK, found that 75% of young people are frightened of the future because of climate change. So that sits in the background as well. And actually, what we're not talking about is when we talk about, are these kids saving for their pension, getting a mortgage, worrying about putting enough food on the table? To me, I mean, that question that you asked me earlier about what will healthcare look like in 25 years' time, there's a part of me that thinks, I'm not sure we'll be anything like what we see at the moment because climate change is actually progressing much faster than they anticipated. And one of the things that's going to happen is we're going to hit a point where we get simultaneous crop failures across the big bread baskets. And when that happens, food prices are going to spike through the roof. And then you're going to get breakdown of economies and breakdown of societies. At the same time, you've got large parts of the world that are going to become uninhabitable. So you're going to get a much bigger waves of climate migration than we're already seeing. And that has already started. And you're going to start to see more conflict over scarce resources like water. So when I look 25 years into the future for my kids, I mean, I had this conversation with my husband a little while ago and we were talking about, should we put some money into pensions for the kids? It's like, no, give it to them now.
Okay.
Because I can't really believe that the same financial systems are going to be working in 25 years' time. And what that looks like for healthcare, I don't know.
It's all gone a bit bleak, hasn't it?
It has. It has.
We're all starving, shoved into the northern parts of the hemisphere, fighting each other with a breakdown of economy, healthcare,
and this is
social
why
structures.
It makes me laugh. Well, not laugh, but just want to tear my hair out when you hear these people saying doing anything about climate change is putting all the burden onto, the poorest parts of our community. The people who are the poorest in our communities are already suffering and they're going to be hit worst and they're going to have no backup when these things start to fall apart. So we've already got over 3 million people in the UK who are at least sometimes reliant on food banks to feed themselves and all their families. What happens to that when food prices go through the roof?
Mm-hmm.
Already the poorer sections of our community are more likely to be living in accommodation that's going to overheat, that's more at risk of flooding, they're more exposed to air pollution. And actually, when you think about the children that are around now, alongside all of this that they're looking forward to, they're already being poisoned by air pollution, by microplastics in what they're eating and what they're drinking, by pharmaceutical pollution. There's a lot that's going on with young people rises in different sorts of chronic diseases, a sudden drop in the onset of puberty. And we don't really know what's causing it, but we know there's a lot of toxins around that weren't around when we were kids. And so there's that impact as well. So they've got a future that's looking much more scary and much more uncertain. Plus the fact that we're impacting their health and their development right from inside the womb.
So we know that the WHO thinks that climate change is sort of one of the great threats to health. What do we do about it? Because at the moment, I'm not going to lie, I'm a little bit overwhelmed.
So Alexis and I have talked about this before. So I'm reminded of the Sean Locke sketch where he talks about climate change as though you're turning up to an earthquake with a dustpan and brush as an individual. And even if you had, 1,000 people with dustpan and brushes, they still need some big machines to shift the large bits of concrete. And so actually we do the big machines to do stuff.
Yeah. And
that means government. And so today we've had discussions about a second runway at Gatwick and listening to the conversations and what the Chancellor thinks are good things of us doing this, which means it promotes growth. It allows more flights so more people can go on holiday where they want to. I'm kind of thinking that's not really going to work.
I mean, there are lots of ways that they could stimulate the economy through green investment. But the trouble is, it comes back to that conversation we were having about what politicians believe about what people want and therefore what they're prepared to do. And so perhaps one of the most important things you can do as an individual is talk about it, is write to your MP, is write to your local paper, is talk about it on social media. Because the thing is, it's difficult to kind of get back to the roots of it. But with social media and the print media being largely kind of controlled and manipulated, it does make it really difficult to get these messages across. And that's one of the reasons why you've got activists out on the street, or jumping on pool tables and running onto pitches to try and just wake people up. But unfortunately, that again has been spun as, well, these crazy people are just getting in your way and making life more difficult. But that's one of the most important things we can do, is try and stop this conspiracy of silence about it and actually make it something that we're all talking about.
Yeah. So, I mean, clearly you need a groundswell of opinion that will change what politicians think or the way they act. And the trouble with activism, like turning up at a sports event or whatever, is you're probably targeting the wrong people. And, my immediate reaction to that sometimes is, what has that achieved apart from annoying a lot of people? But I also think, but it's really important this message is heard, and therefore how do you do something in a way that people are going to hear it? Sadly,
this is a question that I've spent a lot of time thinking about.
So would you describe yourself as an activist?
Yeah.
Okay.
Yeah. So, I've been involved in, with Extinction Rebellion. I'm part of something called Health for Extinction Rebellion, which is healthcare professionals. It was originally doctors for, but there's so many different, nurses and allied healthcare professionals, what have you, involved that we changed the name. But one of the things that I've noticed and I find really interesting, because if you think about like the Ipsos Mori veracity poll, every year they ask people who they trust the most, and healthcare professionals are at the top. Nurses win every single year. Mm-hmm. So we have a trusted voice. And so we kind of have a duty to use that. But the media doesn't really like it. So what I've seen is, yes, if somebody, I'll give you an example. So in the same week that the heat wave happened in 2022, on the eve of that, 2 consultants, 2 GPs and 2 nurses cracked the windows at the major bank, JP Morgan in Canary Wharf, because they're the biggest investors in fossil fuels. Not a single newspaper in the UK covered that. But on the front page all over the place was the lad who jumped onto a snooker table and threw some orange powder paint around. They want activists to be perceived as kind of not people that you need to listen to.
Okay, that's interesting. Yeah.
Equally, when you target the right people. So again, earlier this year, I was involved with the Citizens Arrest Network, where we were performing citizens arrests on the chief executives and the board of fossil fuel companies. Again, the print media, none of the newspapers picked that up at all. It did really well on social media. So then, you're targeting the right people. That's going to go down well in the pub. You're not disrupting the public. You're actually targeting the right people, but the press doesn't pick it up. So you're in this real dilemma of actually the only way that you can get the press to pay attention is to do something more extreme, more disruptive, which then people say, well, I don't know what you think you're achieving like that.
Yeah.
Because it's just turning people off.
And what's really interesting too is it's not just the press, right? So what we've seen is that if you're a healthcare professional and you decide to take part in some of these activities, the healthcare profession itself doesn't look particularly kindly on that, right?
So there's a real problem at the moment. And in fact, to the extent that the UN Special Rapporteur has got involved, that healthcare professionals, alongside any criminal consequences of what they do in terms of activism, which is always non-violent, they're also then facing regulatory problems with, like, the GMC, that's the General Medical Council, and the Nursing and Midwifery Council. And recently, the first kind of still working GP was suspended for being engaged in non-violent protest around climate change. And their argument for that was that it brings the profession into disrepute, which is really interesting because they provide no evidence to support that claim. And actually, when you look at what happens when defendants are allowed to explain why they've done this in court, mostly juries will let them off. So the standard of a sort of a reasonable person, if they understand all the issues, would find this to be problematic or not. Well, that's your kind of evidence around. And in fact, that doctor had a lot of letters of support from his patients and from his practice. And certainly when I was involved in activism and I was arrested, I again got a lot of support from my patient group. In fact, because I was an addiction psychiatrist, they thought it was hilarious that I'd been in prison, but not in prison, in custody. But yeah, actually really supportive. So I think we've got the biggest health risk to public health ever, literally. So in fact, for doctors to remain silent, surely that would bring the profession into disrepute.
What's the thing we said? I said there, it's bad things happen because good people don't do anything.
Yes.
Just sit by and watch it happen.
Yeah.
But it's also asking quite a lot of people, I think. If we consider that if the GMC and the courts continue to be as keen as they are on punishing activists, and we've seen a real change in the kinds of things that climate activists are charged with, right? It used to be things like obstructing the highway, or I don't know all the technical legal terms, but
certainly they've changed the legislation to be much more draconian.
Yeah, so more people are getting charged under public nuisance laws, which carry much,
but there is also
bigger.
So I was looking at something that was about doctors sort of worried about AI, a particular platform in the NHS. But some of the demonstrations were complaining about this, but also they included Palestine and Palestinian flags around. And I think one of the trouble from, I can see the government's point of view slightly, or the police's point of view slightly, there is often a bit of interplay between different causes happening. So I'm struck as an observer of Greta Thunberg that she was the champion, and a very loud and I thought very effective champion to raise awareness of climate change. But now she's moved over to more political issues, particularly around the Middle East. And that makes you think, well, did she really mean it in the first place? And I think we do have to be a bit careful that as doctors, we don't get overly political, but we should focus on things that are important about health.
I think the problem is the more you know about this, the more you see how everything's connected.
Yeah.
So certainly activists that are also now involved with Gaza, it's not because they've decided that climate change isn't so important anymore. It's because all of these things are connected. So we wouldn't be in the position that we are now were it not for the power of big global corporations and for the increasing shift away from democracy in many countries. All of that is linked because late stage capitalism basically says we extract, people are expendable, and we make as much profit as we can, and we concentrate money and power and land in the smallest number of hands possible. And that, I guess, is what they think is their end game in terms of climate change, because they're not stupid people. I do spend a lot of time sometimes thinking, how do you think you're going to survive this?
Yeah.
I think they tell themselves, because throughout history, generally the rich and powerful have weathered the storm, but this isn't going to be a storm that's going to end, it's going to get worse. So yeah, I think they're making a big mistake, but all of these things are linked.
Okay.
And it all comes back to social justice. If we're going to create a properly sustainable community locally and globally, then it's got to be more equitable than it is now.
Yeah, I mean, I think that's completely fair. I was touched by what you said earlier about the role of traditional print media. And I think you could imagine that 40, 50 years ago, when everybody got their news from reading the papers every day, that's how people were influenced. But I was amazed to see how much influence the big editors and of the big news corporations, including sort of televisual media, have to play, particularly when it comes to who becomes our prime minister and who gets elected. And it's a little bit scary. So I was reading a book by James O'Brien called How They Broke Britain after Christmas. And he's quite left-wing, so I don't necessarily agree with everything he says, but it was a little bit frightening about the role that the media moguls play in shaping our lives.
Of course. I mean, these are, I think at the end of the day, we sometimes forget the media is a business. And so they're not a public service. They're a business.
But
I'm not excusing them, but I'm saying it helps, I think, to understand that they are going to choose the thing that they think is going to sell the paper that day.
I get that, but I think these organizations are so powerful that we have to bring back the idea that businesses and organizations have some kind of social responsibility.
Oh, yeah.
And, some of this is really deliberate, and some of it is actually through aggressive foreign powers as well, who are manipulating these systems, particularly in terms of social media. So, how did we end up with Trump as president of the United States? How did we end up with Brexit? These things are hugely influential. And the trouble with social media is it should allow us to contact so many more people and to, have much more breadth of debate. But actually the way that it works because of the algorithms is it just pushes everybody into their own little bubble.
Their bubble, yeah. And you just
and
see
then
what you
more and
want
more-
to see.
More and more extreme views become validated on both sides.
Yeah. So, I mean, we've talked a lot about kind of where we're headed, which is rather dark, and how we got there, which is also rather dark. Do we have any light?
One of the things that frustrates but also kind of gives me hope is the fact that if we do the things we need to do to tackle climate change kind of across our societies, that it's actually a real gift for health. So if you think, if we cut out fossil fuels for energy and also move away from car dependency, then not only do we massively reduce air pollution, and we saw during COVID how quickly that dropped asthma admissions. And if that had gone on for longer, because air pollution gets into every bit of your body, it crosses into the brain, into the placenta, it's implicated in almost any chronic disease like heart disease, stroke, diabetes, even obesity, all sorts of illnesses. I couldn't find one that wasn't in some way related. When I was trying to do an MCQ and have a one that wasn't, I was just like googly, just like, no, I give up. Yeah, so first of all, air pollution, cleaner air, but also a more active population. So we know that a large percentage of the UK population is not active enough for good physical or mental health. So we get people more active. At the same time, a lot of that car-related infrastructure in our cities, so lots of the width of the road, the amount of parking, that is then freed up to bring nature back into our cities, which we know, again, that green space, spending time in green space is really good for people's physical and mental health. And it's just a much nicer place to live. If you've got nature around you, you've got trees, they also help keep things cool, particularly in cities during heat waves. Cities tend to heat up more than the surrounding area. They help reduce flood risk. So there's that. It's just, we could be living in a much nicer environment. We also could then potentially be using some of that space to grow some local food. So that would help our food security. We know generally in terms of our diets that we're eating too much meat, too much dairy, too much highly processed food. So if we switch to more of a plant-based, it doesn't mean everybody's got to be strictly vegan, but more of a plant-based diet, we know again that has enormous health benefits, both for our physical and our mental health. And also, of course, that's one of the strongest levers because, we think about climate change, we think about transport, and we think about energy, but actually agriculture has a huge impact in terms of climate change and also, things like deforestation and many of the other environmental problems. So there's that, and also insulating people's homes so that people are not living in cold, damp, moldy conditions and unable to heat or, and eat. I spent my working life as an addiction psychiatrist working with people who were living in those conditions, and it's terrible for their physical and mental health. As a population, if we do these things, we get healthier, but the people who benefit most are the people at the bottom of the income scale. So it also helps to reduce health and social inequality as well.
So there's a bit of a win-win in the sense that we do
Massive
get
win-wins.
healthier. We help to reduce some of the inequalities that we have.
Most of us will become parents at some point in our lives, and with parenthood comes a flood of new questions and worries, like, will my baby ever sleep through the night? When will I feel like myself again? And why on earth is their poo that colour? So much of what we hear about pregnancy, birth and raising children is built on myth, rumour and outdated advice. That's where the Science Baby podcast comes in. Hosts Dr Layla Battison and Dr Kim Bartholomew are science communicators, first-time mums and unapologetic nerds. Each episode we explore the evidence behind common parenting advice, bust some myths, share surprising facts about you and your child, and help you navigate this extraordinary, exhausting stage of life with confidence. Find the Science Baby podcast wherever you get your podcasts.
I know that there's been some examples where people have tried to create sort of more eco-friendly or carbon neutral protocols in healthcare and found that it can be cheaper as well.
Yeah, so that was kind of looking more broadly. If we think about what we need to do in terms of healthcare, so I work for the Centre for Sustainable Healthcare, and one of the things that has been developed by them is the framework which we call sustainability and quality improvement. So that's basically using the quality improvement that we would use to innovate and improve things in healthcare anyway, but it's kind of weaving sustainability into that. And there's two main differences. One is what we call the principles of sustainable healthcare. So the first of those is prevention. So that comes back to the stuff I was talking about anyway, but also thinking about prevention more broadly in terms of, yes, let's try and keep people healthy so they don't come into healthcare facilities, but also once they're there, let's treat them effectively and quickly so that they don't get complications. Anything that you do that prevents more downstream health activity is to the good. So things that you might not think about as sustainable, like vaccination and smoking cessation clinics and stuff like that. So that's the first one, is prevention. The second one is patient empowerment. So supporting people to do more to sort of self-manage their own health and their own healthcare conditions. So one of the kind of unintended consequences of having a free healthcare system is that people get a little bit sort of disempowered to look after their own health, because it's, and this is why we end up with, people phoning the ambulance service because they've broken a nail. My kids always tell me about, when they go off to university, it's like, oh my God, people are going to A&E when they could have just taken a paracetamol. So, it's that, but it's also, particularly for chronic diseases, and we're seeing so many more people with chronic diseases, partly because, we're breathing in polluted air and we're not active and we're eating the wrong stuff and all of that, but also because we are living a bit longer. But that's not all of it, because actually the rates of chronic disease in younger people is going up too. So actually helping people to understand why, what they can do to avoid that, but also how to manage those health conditions themselves. So empowerment, that's another thing which helps to reduce healthcare activity. So the first three principles are about reducing healthcare activity, because obviously you can make the most benefit by not having to do healthcare activity.
And it's quite interesting because those first three that you're talking about are what we're talking about more generally in healthcare right now, right? We want to move away from hospital care. We want to look more at community care. We want to focus more on prevention. At least that's what the government says. I mean, you're looking at me incredibly skeptically right now, God. But
no, I mean, everybody says that laughter is the best medicine, which is not true. Exercise is the best medicine. It's amazing how many conditions can be prevented and can be improved by actually being a bit fitter.
And not eating rubbish. Yeah.
Yeah. So I cycle to work, and the reason I started cycling to work, which is about 10 miles, A, to try and get a bit fitter, but B, it helped rest my conscience when it came to polluting the atmosphere. I always find it ironic that when it's absolutely tipping it down with rain and the planet is giving me back, I don't feel like I'm saving much. But it does give you, when you turn up to work, a really
and you don't have to find parking.
A high moral position. And then when there are big queues coming out the car park and everybody's talking on WhatsApp about,
and you just cycle smugly past.
It's wonderful.
Yeah, no, it's brilliant. I used to cycle to work, and the trouble was we didn't have the facilities to support that, so there was no shower. So I'd end up going into the toilets and trying to have a strip wash in the sink. You could have fried an egg on my face for the first hour that I was at work. And yeah, cycling home when it's absolutely tipping it is not the most fun in the world.
Don't tell them I used to do research. I cycled in. I used to stand in the cold room their 10 minutes with all their dry ice specimens because it was the best place to get cold.
Because there's no air conditioning in hospitals, so it all comes back around again, doesn't it?
I think the other positive thing about is that humankind has generally managed to find solutions to things when it's needed to. And I still think we're quite ingenious, whatever the word is, as a species. And things like fusion, I think we may find new ways of providing power that do not produce carbon and a carbon footprint. I also think that we'll find better ways of extracting carbon from the atmosphere. But my worry about that is all that stuff is really expensive. And it comes back to the whole thing of governments will only invest and do stuff with that if they can see that it's going to be useful. So the good old tipping point, I'm fascinated to think, well, what is the tipping point going to be? And sadly, I think it's going to be when something goes horribly wrong. It's like the pandemic was a horrible tipping point, but it got us working in different ways.
It is really interesting because you look at the stuff that's happening around the world, the wildfires and the floods and the storms and etc. And you kind of think, how bad does it have to get?
Yeah, well, I sort of feel like we're already there, aren't we? I mean, my mind, we're already there, but clearly in lots of other people's minds, we're not.
But I think, the other thing, as you say, that kind of does give me hope is at the moment we hear a lot about how greedy and selfish we are as human beings. But actually the reason that we've got the complex global societies that we've got is because we're actually really good at collaboration and we're really good at caring for each other. So we've got to listen to that side of ourselves, go back to that kind of, fairy tale about which wolves do you feed. We've got to think of ourselves as people who care for each other and look after each other. And as you say, are incredibly innovative. We're smart, and hopefully if we pull together, we can pull ourselves out of this. But we've got to start doing that. At the moment, as I say, it feels like we're being pushed by the media towards more fragmentation and more blaming other poor people, migrants or people of different colour or gender or, whatever.
Yeah, it feels like a lot of smoke and mirrors to find scapegoats, multiple scapegoats actually, for what are fairly kind of straightforward problems. And we know that the climate change exists.
We've got the tech to solve this. We've got what we need. We actually don't need that much more innovation. We just need to do the things that we already know how to do and scale them up properly, rather than just continuing to dig in and make as much money as we can from the way that we are doing things at the moment.
Yeah.
And preparing for those waves of climate migration by stoking racism.
So here's a bit of a curveball. This is going to sound like the most obvious sentence ever, but I'm a big believer of evolution because it's a real thing. And I wonder...
You might just have distanced probably 25% of our audience by saying that.
What, that I believe in evolution? Yeah. Okay, well, sorry.
Okay.
I'm okay with that. Yeah, evolution is real. I just feel like let's put that out there right now.
Just as climate change is
real. Just
as
climate change is real. Doesn't matter what it says on Truth Social. Climate change is real. But anyway,
other origin of species are available.
Other origins of species are available, as we say on the BBC. Right. So anyway, to bring us back around, is it possible that humans as a species aren't able to adapt, aren't able to make the changes and the sacrifices that are necessary to save the planet? Have we evolved to a point where we're too selfish?
No, that's exactly what I'm saying. We're not too selfish.
Okay.
We do work. You look at what happened in the pandemic. Communities came together to support each other. You look at what happened after Hurricane Sandy in New York. The community came together, something called Operation Sandy, and they looked after each other. It is quite entertaining, actually. They kind of co-opted the Amazon wedding list site, and they had Sandy and Sandy getting married, and they could go around, ask people what they needed, put it on the wedding list, and then people would get it delivered by Amazon to their hubs, and then they would go out and give it to people.
Oh, that's cool.
So there's lots of examples. Again, in Greece, when there was that big collapse of the public finances and public services, they started delivering healthcare from people's living rooms. And what's interesting about that in terms of how do we make better sustainable healthcare is when people came in, what happened was they sat down with a multidisciplinary team of, a doctor and a psychologist and a social worker, and they talked through what all their problems were. And a lot of the time, as we know, a lot of what comes into GP surgeries is not necessarily medical. Sometimes it's social problems.
Oh, yeah.
Sometimes people just need to talk. And a lot can be done just by allowing that. And I heard another really good talk about the healthcare services for Indigenous, the Native Americans in Alaska, they were given the budget to kind of say, okay, you can redesign it, do what you want to do. And they based it around primary care with a lot of mental health support. And so, when we think about what do we need to do in healthcare, I think, there's a lot of talk at the moment about care in the community and bringing care closer to home. But I think we also need to listen to both of those models in terms of actually we need to push the balance more towards supporting people's mental health and their social problems as well. Because if we're just dealing very mechanically with the physical health, then we're not dealing with why they've got to this problem in the first place.
Well, and this brings me to something I wanted us to talk about as well, is this idea of sort of eco-distress or climate anxiety, because it is really hard to talk about climate change without feeling kind of overwhelmed at the scale of what's going on. And definitely, I often feel like I'm just showing up with a dustpan and the broom to rubble. So what do we do about that? I mean, I'm putting you on the spot, but you are a psychiatrist.
I talk about eco-distress because when people talk about climate anxiety, it kind of suggests that it's just fear, but it's a really complex mixture of emotions. As you said, people feel overwhelmed, they feel helpless, they feel grief and rage and all, lots of different things.
Anxiety kind of makes it small or even solvable, right? Because you can treat anxiety.
I mean, the other thing to say really, really importantly is that eco-distress is not a mental health disorder. It's a rational response to the situation that we're in.
Fair enough.
So, you can't use therapy or medication to deal with this. What you need to do is actually do something about the core problem. So there's a really good organization called the Climate Psychology Alliance. And they offer like climate cafes and climate counters, psychology, you can talk to people. But what the advice boils down to is there's a few things that you need to do. So the first of all is do something, take action, because the worst thing for our mental health is to be in a really frightening position and to feel powerless. So by taking action, you can feel like you're contributing, you're taking back some sense of agency. And also when you take action, it tends to put you in contact with other people who get it, because with this weird conspiracy of silence we have about this, often people feel really isolated with their concerns. So actually contacting other people who are feeling the same way and realizing that you're not insane is really, really helpful, and it creates a community of support around you. But having said that, around taking action, it's really important as well to recognize that you can't fix it yourself. You can do the piece of the puzzle in front of you, but you can't fix it. So you've got to put some boundaries around what you do. And I've fallen foul of this, I'll admit myself. You've got to work out what's sustainable for you as an individual and do the things that call to you. Don't do things that make you feel tired and miserable just thinking about them. Think about what brings you joy, where are your skills, what needs to be done, and somewhere in the intersection of those is where you should be taking your action, but also making sure you're leaving time to look after your core business, which is your health, your family, your life. So it's got to be sustainable for you as well. So give yourself time to nurture hope, also time to switch off from it and do whatever. I mean, ideally, maybe spend some time in nature or binge on Netflix or read some crap fiction, or some good fiction. Give yourself a break. And sometimes it can be important to come together with other people who get it to process some of what you're feeling. So I've done a series of grief workshops with some of the people from Health for XR, which were really, really helpful.
That's very positive. So you've talked about 2 principles of sustainable healthcare. There are 4, you say. So what are the other 2?
The third one that helps reduce the amount of healthcare activity is lean pathways. So stopping doing things that are low value to patients and potentially harmful. So things like over-prescribing, over-investigating, over-diagnosis, and just streamlining our pathways to make them more efficient. And then the 4th principle is low carbon. So the healthcare activity that we need to continue, we need to think about how we can deliver that with reduced environmental impact. And that can involve things like reusable equipment, going back to that. Also things like switching to lower carbon inhalers, lower carbon anesthetic gases, but also different approaches like, for example, virtual care. There's a really good case study that we use, which is looking at care of people with chronic conditions like heart disease and diabetes. And they're all managed at home. They have equipment to monitor themselves in terms of blood pressure and oxygen levels and what have you. And it goes into a hub. And if they come outside of their preset sort of criteria, then they will get contacted. So rather than people coming in for regular reviews when they might be fine and they don't need to be seen, but it might be 3 months after they started to get not fine, patients are actually being seen when they need to be seen. They're much better at looking after their own conditions. Their carers are more confident. And it's massively reduced admissions, general use of healthcare, and actually improved clinical outcomes. So there's lots of ways that we can do things differently with reduced impact. The other change that we talk about is what we call the sustainable value equation. So when we look at a new health innovation at the moment, we tend to think of cost effectiveness. So the sustainable value equation, instead of just thinking about the outcome for the patient, you're also thinking about the outcome for the population. So, for example, if you've got a care pathway where people are going in and out of hospital all the time, that's increasing transport emissions and air pollution is bad for the population. And then sort of under the line in the equation, we've got not just financial costs, but also environmental impact and social impact. So again, if you've got people coming in and out of hospital unnecessarily, then you're taking them away from education or work or caring responsibilities and making life difficult for them. So, and also thinking about things like well-being of staff and the, how acceptable the service is for the patient, whether it's meeting their needs and whether the people who really need that service are actually coming in. So it's what we call the triple bottom line. So social, environmental and financial. So it's just a different way of thinking about what we're doing, and that can be used at any level, from individual clinical decision making to thinking about how you design a care pathway or a healthcare system.
But that's another way, as a positive way for people to think about what they can do. So I have watched, there's a movement, if you like, within gastroenterology called green endoscopy, about how we can save, because endoscopy uses up a huge amount of water.
I'm sure.
And also we use things like nitrous oxide and gas and air, which is quite a potent greenhouse gas, and finding ways to not do those things. That's been quite fun, as we've learned. And they're enthusiasts, and they provide the evidence, and it works. So I think there are things that we can do practically.
Yeah. It does make me think that in healthcare we need to be pushing. We ask resident doctors, for example, to engage in all sorts of research and activities as they're training, and taking a protocol and seeing how can we do this greener, how can we reduce emissions, how can we reduce waste.
What we've found working with even really burnt out teams post-COVID is that SUS-QI actually really motivates people. I mean, when I was working clinically, you start talking about QI and people start falling asleep. Yeah. But lots of people are worried about this in their private lives, and then they feel like they're trying to make changes at home. They come to work, they feel like all of those values go out of the window. So if they can live their values at work, and also because of, the triple bottom line. So if their major concern, obviously, is for most people is quality of care, but also maybe social justice and social equity, also perhaps worried about the bottom line financially. All of those things are in there alongside the environmental thing. And what we see with the SUS-QI projects is they save loads of money, and they're generally good for patients and for staff. And obviously there's a reduced environmental impact. So it's something that's really exciting for people to get involved with.
You know that I have a bit of an interest in AI, and AI is currently being touted by some of the commentators as one of the solutions to NHS and health sector inefficiency. And I can get from what you were saying, the right thing to do is have the right, not to waste stuff by having the right stuff in the right place at the right time. And AI should help us with that. AI, though, and as we rely more and more on computers and the internet, uses up a lot of energy, and water in particular for cooling. And I saw a wonderful quote, or using ChatGPT to calculate it, about a 500 ml bottle of water is how much water is used every time you ask a ChatGPT question of about 100 words. The millions of people who are using ChatGPT and other bots are available to do their work for them. That's actually costing the planet a huge amount. And I'm torn by that, because I think AI is part of the solution that we have for improving healthcare and other parts of our society. But I do worry that it's going to be using up resources in particularly water, which is much harder to replace. You're getting energy from the sun and the wind, and maybe fusion, you can think about that, but where would we get extra water from? Yeah, so do you have any thoughts on that?
So about AI and that balance, I mean, first of all, I would say, all of these things that, people come along and say, oh, this is a silver bullet that's going to fix it. There's never a single silver bullet. We're talking about complex systems. So yes, AI will have its place. My husband's a GP, and at the moment they're using AI to take notes during consultations, and it's saving them loads of time. And I look back to my time in psychiatry and the hours that I used to spend typing up long psychiatric assessments. And I think, my God, if I'd had AI to do that, I could have gone home at a reasonable time in the evening. And I could have been looking at the patient instead of typing things into the computer, and that's so important. I mean, one of the things I'm really passionate about is the way that we fix healthcare. One of the important aspects of that, having just said there is no single silver bullet, but one of the most important aspects, I think, is about revaluing the importance of relationships in healthcare. Because what we've got at the moment is a system where we've got more and more people with more than one complex chronic disease. And every time they see a healthcare professional, they have to explain all of that over and over again.
Yeah.
And that's the definition of inefficiency. Plus, it makes those people not trust the service. It makes them feel like they don't know what's going on.
Nobody knows.
And it just wastes time, and it makes it really stressful for healthcare professionals. So if we can actually run it much more efficiently by working out a system whereby actually people are seeing the same person. And that to me is about investing in primary care and making sure that we've got more generally trained secondary healthcare professionals or teams that work together better. That's really important.
So I think it's a good place for us to wrap up, but that sustainable healthcare will make the world a better place in lots of different ways.
It aligns with, tackling health inequalities, with personalization of care, and also obviously, managing the NHS.
People will be happier and healthier, and our planet will be healthier too. So, win, and I lost track of how many wins that was, but there's a lot of wins.
There's a lot of wins.
And so I think that's hopefully our more positive take-home message of what was genuinely a terrifying episode at times.
The trouble is, if you don't think about how terrible it could be, you then won't act. So I do think you need to bear that in mind.
You need the terror.
I have been struck by how relatable much of what you've said has been, and how it makes a lot of sense to me. And I just get then frustrated with our leaders for not actually taking it on board and doing things. But the road is but started, and hopefully we can make some progress.
We just all need to be rattling their cage a little bit more and making it clear, just reassuring them that it's okay, that people want this. We all want a healthy future. Why wouldn't we?
Well, I think we've challenged and shocked the audience enough for today. So we'll bring things to a close. Hayley, thank you very much. I've learned a lot. Alexis?
Yeah, I've learned a lot. I'm terrified, but also excited about what the future can hold. And I think it's been really helpful to think about what can we do to make things better. I think that's what I'm going to take forward from this. So thank you very much, Hayley.
Yeah. If any of your audience wants to learn more, my job literally is to run training courses in sustainable healthcare. So look up the sustainable healthcare. Yep, it would be good to see you. And there's a lot more to say. They had to stop me from waffling because I can talk about climate change and health till the cows come home. So thanks for giving me the opportunity to do that.
This has been a Haunted Mouse production. Cut that out.